Hi everyone, my name is Jean and I'm a fourth year DPD student at Cornell University. Today I'll be giving a short presentation on one of my summer experience with Katie Dodd, who is a geriatric dietitian and had 11 years of experiences in geriatric nutrition. Today I'll be discussing what I have done, which is designing high-calorie recipe for older adults, and also I'll be sharing what I have learned throughout this program and why I think geriatric nutrition is important. So right now I'm going to share my screen and discuss this issue with you guys. So again, I really appreciate that I have an opportunity to work with Katie Dodd, and her website, which is her own brand, the geriatricdietitian.com, has a lot of useful information on different topics about geriatric nutrition, and she provides evidence-based information to healthcare providers, and the blogs are also easy to understand. So even you're just taking care of your family member, you can refer to her website. So I will begin on to share what I've read and learned throughout this program in the past 2 months. So first, I'll be discussing why we really need to pay close attention on the aging population. According to data from World Population Prospects, the 2019 revision, by 2015, 1 in 6 people in the world will be over age 65, which is 16%. And according to the United Nations, the world's population is aging. It's not an issue that exists in the United States, but in all other countries. And virtually every country in the world is experiencing growth in the number and proportion of older persons in their population. As a growing percentage of individuals will be living into their 8th and 9th decades of life, individuals are no longer just aiming for live longer, but they want to improve their quality of life. Aging successfully means minimizing physical disabilities as well as cognitive impairments. Weight loss and undernutrition are associated with troublesome and poor health outcomes of older adults. So an early detection of illness and nutrition intervention can really make a difference. I know a lot of people are focusing on weight loss, and weight loss is really a popular trend in the society. However, weight gain is specific to our older population. Older adults who are experiencing unintentional weight loss are the target population for gaining weight. And without that extra calorie, weight loss can significantly diminish their quality of life and sometimes can even be life-threatening. And that's why we need to fight for reduced weight loss. So on average, older adults who are over the age of 70 years consume 1/3 less calories than younger people. And for protein consumption, 10% of older men and 20% of older women have intakes below the US recommendation. About 30 to 40% older adults over 75 are underweight. And they are prone to acute illness, which is characterized by spontaneous decrease in food intake. Decrease in food intake in older adults is reported both before and after hospitalization. And according to clinical assessment, lower total lymphocyte count and decrease in albumin are more likely to be observed in older adults who are not eat sufficient calories. Why older adults are more sensitive to weight loss as compared to our younger population? Here are 3 major reasons. First of all, starvation. Starvation is defined by failure to consume adequate food, and there are various reasons can contribute to starvation in older adults. For example, lack of food access, inability to digest, and also anorexia, which is characterized by poor appetite. The second reason is sarcopenia. Sarcopenia is a term that means the loss of muscle protein mass, muscle function, and muscle quality. So sarcopenia are usually caused by change in body composition, and it is a natural phenomenon that older adults are more likely to experience in decline in growth hormone, and also they are less likely to be physical active, and all those reasons are contributed to sarcopenia, which is defined by decrease in muscle mass. And the last reason is cachexia. Cachexia is also a term defining muscle wasting, but it is associated with disease. For example, patients who are experiencing cancer, pulmonary heart disease, congestive heart failure, all those diseases can cause cachexia. And cachexia is usually defined by the presence of pro-inflammatory cytokines, which is related to disease conditions. Why we really need to give them high calories to stop that unintentional weight loss? Because the consequences of weight loss could be really severe, like increased mortality rate, higher rate of life-threatening complications, longer hospitalizations, higher comorbidities, and infections, and also oxidative stress. I've heard to talk about why we should give older adults who are experiencing unintentional weight loss high-calorie snacks. And here are some tips that I generated throughout my experience of creating those recipes. So you can start from choosing ingredients by looking at the high-calorie recipe food list. So if you don't know where to start, I can recommend you to look at them. There's a blog created by Katie on her website, and she lists a bunch of foods that are high calories and also give some specific recipes that you can follow. Always think of the taste because older adults are more likely to have a reduction in appetite, so you can increase sourness or sweetness to make it more attractive to them. So for example, during hot summer, you can choosing some seasonal fruits to make smoothies or add some yogurt to make it more tasty. Always have those common health problems in mind. Older adults are more likely to have the difficulty of chewing, and they were experiencing xerostomia, which is a symptom of lack of saliva in their mouths, or dysphagia, which is difficulty of swallowing. Creating high-calorie snacks does not necessarily have to purchase expensive ingredients. You can start from some simple and cheap ingredients that are available around you. So here are some examples of the recipes I created for older adults. For example, this dragon fruit yogurt and this peach Yakult are all using seasonal fruits and mixed with dairy products to boost up the calorie. And this a chocolate shake is really a high calorie and high protein milkshake, and I highly recommended this recipe. Blueberry pudding is a puree formed snack, which is great because for people who have dental problems and difficulty of swallowing, this pudding is really soft and easy for chewing. And this fried mashed potato is a salty recipe. So here are the references for my presentation, and I would like to end up my presentation with this quote: "Age is not lost young, but a new stage of opportunity and growth." So always keep in mind that we all will be old someday, and let's advocate for healthy aging. That's all for today. Thank you.